Assalamu alaikum. My name is Amber Fatma. I'm from the department of BSPT. Today the topic I'm going to represent is gamma hydroxybutyrate. What is gamma hydroxybutyrate? It is a central nervous system depressant that is commonly used as a recreational drug. It is also used medically to treat narcolepsy, alcohol withdrawal syndrome. GHB is a depressant drug, which means it slows down message traveling between the brain and body. GBL, gamma butyroactone, and 1,4-BD butyridiol are chemicals that are closely related to GHB. Once GBL and 1,4-BD enter the body, they convert to GHB almost immediately. In recent years, GHB has gained attention as a potential treatment for alcoholism and certain neurological disorders. Development and discovery of GHB. GHB is a powerful, rapidly acting central nervous system depressant. It was first synthesized in the 1920s and was under development as an anesthetic agent in the 1960s. GHB is produced naturally by body in small amounts, but its physiological function is unclear. Liquid packaged in vials or small bottles. In liquid form, it is clear, odorless, tasteless, and almost undetachable when mixed in a drink. GHB is typically consumed by the capful or teaspoonful at the cost of $5 to $10 per dose. The average dose is 1 to 5 grams and takes effect in 15 to 30 minutes depending upon the dosage and purity of drugs. Its effect lasts from 3 to 6 hours. GHB was sold in health food stores as a performance enhancing additive in bodybuilding formulas until the Food and Drug Administration banned it in 1990. It is currently marked in some European countries as an adjunct to anesthesia. GHB abused for its ability to produce euphoric and hallucinogenic states and for its alleged function as a growth hormone that releases agents to stimulate muscle growth. GHB became a schedule controlled substance in March 2000 in United States. GHB produced in clandestine laboratories with no guarantee of quality or purity, making its effects less predictable and more difficult to diagnose. GHB can be manufactured with inexpensive ingredients using recipes on the internet. Gamma butyroactone and 1,4-butyridiol are analogues of GHB that can be substituted for it. Once injected, these analogues convert to GHB and produce identical effects. GBL, an industrial solvent, is used an immediate precursor in the clandestine production of GHB. The FDA has issued warning for both GBL and 1,4-butyridiol, stating that the drugs have potential for abuse and are a public health danger. Now, its chemical structure and properties. Chemical structure. The chemical structure of GHB consists of GBL ring with hydroxyl group attached to the carbon next to lactone ring. The chemical formula for GHB is C4H8 and O3. Now its properties. Physical state. GHB is usually found as a clear colorless liquid, but it can also be obtained in powder form. Solubility. GHB highly soluble in water and other polar solvents. Taste and odor. GHB has slightly salty taste, often described as salty water or soapy. It does not have a distinct odor. pH. GHB is a weak acid and has a pH around approximately 4 or 5. Metabolism. GHB is rapidly metabolized in body primarily by conversion to succinic semialdehyde and further metabolized in succinic acid, a common intermediate in acetic acid cycle. Now we will discuss some street names. Street names for GHB is Cherry Math, Fantasy, GBH, Georgia Homeboy, Great Hormones at Bedtime, Grievous Bodily Harm, Liquid E, Liquid Ecstasy, Liquid X, Organic Q-Lord, Salty Water, Scope, Sleep 50, 500, Soap, Smotamoza, Vita G. Mechanism of action of GHB in brain. GHB primarily acts by binding to two receptors in brain, the EHB receptors and the GABAB receptors. These receptors are found in various regions of the brain, which includes the cortex, hippocampus, and striatum. GHB receptors. GHB bind to GHB receptor, which is an inhibitory receptor Activation of these receptors lead to the release of gamma aminobutyric acid, a neurotransmitter that has inhibitory effects in brain. GHAB reduces neural activity, resulting in sedative and hypnotic effects. GHB binding to GHB receptors can also modulate the release of other neurotransmitters such as dopamine, serotonin, and norepinephrine, which may contribute to its effects on mood, reward, and sleep. Now, GABA receptor. GHB also bind to GABA receptors, which are metabotropic receptors that modulate sympathetic transmission. Activation of GABA receptors lead to hyperpolarization of neurons, reducing their excitability. This effect is mediated by the activation of potassium channels and inhibition of calcium channels. By activating GABA receptors, the GHB enhances GABAergic neurotransmission, further enhancing its sedative and hypnotic effects. In addition to its interaction with specific receptors, GHB has also been found to increase the release of dopamine in the brain's reward pathway, particularly in nucleus accumbens. This effect is thought to be contribute to GHB's euphoric and reinforcing properties. However, the precise mechanism underlying GHB dopamine release are not fully understood. The diagram which shows the GHB which change into GHB receptors and GAB receptor. Understanding the pharmacokinetics and pharmacodynamics of GHB is important in determining its effect, dosage regimens, and potential risks. Now, pharmacokinetics and pharmacodynamics of GHB. Pharmacokinetics of GHB. First, absorption. GHB can be administered orally or through intravenous injection. When taken orally, it is rapidly absorbed from the gastrointestinal tract and reach peak blood level within 13 to 16 minutes. Distribution. GHB has higher water solubility and can distribute throughout the body, including crossing the blood-brain barrier. It is also known to distribute into various tissues such as liver, kidney, and lungs. Metabolism. The metabolism of GHB primarily occurs in liver. It undergoes rapid oxidation to form succinic semialdehyde, which is then metabolized to succinic acid. These metabolic pathways involve enzymes such as alcohol dehydrogenase and aldehyde dehydrogenase. Elimination. GHB is primarily eliminated through renal excretion. It has a relatively short half-life of approximately 13 to 60 minutes, although this can be varied depending on individual factors. Pharmacodynamics of GHB. GHB-ergic effects. GHB acts primarily by binding to GABA receptors in brain. It enhances the inhibitory effects of the neurotransmitter gamma aminobutyric acid GABA, resulting in sedative, hypnotic, and anxiolytic effects. GHB can also stimulate GHB receptors, although the specific role of these receptors is not yet fully understood. Dopaminergic effects. GHB has also been known to increase dopamine release in certain brain regions, including the nucleus accumbens, which is associated with reward reinforcement. This mechanism contributes to euphoric and pleasurable effects of GHB. Effects on sleep. GHB has significant effect on sleep architecture. It has been found to increase slow wave sleep, which is the deepest stage of sleep, surpass rapid eye movement sleep. This effect can lead to sedation and alteration in sleep patterns. Respiratory depression. GHB has potential to cause respiratory depression, especially at higher dose. This effect can be dangerous if its respiratory function becomes significantly impaired. Tolerance and dependence. Prolonged or frequent use of GHB can lead to the development of tolerance, requiring higher dose to achieve the desired effect. It is also associated with the risk of physical and physiological dependence, making abrupt discontinuation or withdrawal potentially challenging.